are back with our sponsor, RN and diabetes counselor Sharon Wiess from the Arkansas Heart Hospital. We're going to talk about complications from diabetes because this can affect so much of the body, right?
Absolutely. There is not a portion of the body that is immune from the effects of diabetes. We're looking at cardiovascular, we're looking at muscles, we're looking at bladder, we're looking at the nervous system. Absolutely. Any place that blood travels in the body can be affected adversely from uncontrolled diabetes.
So important to get it diagnosed and get education. I know that's what you feel so strongly about.
As a certified diabetes educator, yes, I do.
Yeah.
Education is really the cornerstone to managing diabetes. Once you understand what the disease is, what types of food to eat in moderation. I don't believe in eliminating absolutely everything from your diet, but I think things in moderation is the key. Being physically active, understanding your medications, that is so vital. Once you know that, then it helps it to fall into place so that you understand, oh, I'm supposed to take this pill before I eat my meal. This one I can take at bedtime. This one, it doesn't really matter when I take it. I can make it work into my life.
Okay, let's talk about some of the things that it can affect specifically. You mentioned a few. Cardiovascular, first one we think of.
Absolutely. Cardiovascular, when you're thinking about that, you've got hypertension, your risk for heart attack increases, even atrial fibrillation that is talked a lot about in the news today is affected by high blood sugars, congestive heart failure as well. People with diabetes are more prone to have heart attacks as well as to need stents, interventions, and bypass surgery.
Okay, a lot of people may not think about kidney disease.
Kidney disease is really there at the cornerstone of it. I call them our last little soldiers at the gate. And there's other things that are involved with the kidneys that we don't necessarily think about. One of them being our bladder, because the bladder is affected by what we call the autonomic nervous system. And what happens with that is it just does its job, but as things progress and diabetes continues to affect that area, the bladder is something that we see, and incontinence is one of the things that women experience a lot with that. And then erectile dysfunction for men, that is so profound with. Oh, absolutely. And unfortunately, as our population of people that have diabetes is becoming younger and younger, this is something that is out there that is affecting the young men in our country. And I feel like it's probably an under-talked about and under-treated complication for them.
I understand that they're embarrassed to ask about that part.
Absolutely, they're embarrassed.
Yeah, okay, so you mentioned nerve damage, the wounds. We've heard of that, how they don't heal.
Yes. In fact, our wound care center at Arkansas Heart Hospital treats a wide variety of diabetic wound ulcers, and they do it either by dressing changes or by the hyperbaric treatments. With the wound delayed, not only are you thinking about feet, but you're also thinking about surgical incisions as well.
Okay, so management is key.
Management
and there's
is key.
Several steps. You want first better eating.
Better eating habits, be more physically active. Weight loss is important, you know, and everybody at one time or another knows someone or has struggled with weight themselves. And sometimes it's not always as easy as just cutting back on something. It may become either a medically supervised weight loss program or even the metabolic surgery that is now becoming to the forefront really as a treatment for diabetes. And so I think that anyone out there that is struggling with this, please contact Arkansas Heart Hospital because we have a metabolic program.
If you've tried everything else, it may be the answer.
It may be the answer for you.
Okay, you said you have a class coming up this weekend?
Yes, we do. Near and dear to my heart. It is our diabetes boot camps, and we hold them once a month. This month it's in Little Rock, next month it's in North Little Rock, and then we travel throughout the state to do that. It is a free diabetes class, and we start at 8 o'clock in the morning, we go till 3 o'clock in the afternoon. We serve lunch, we laugh, we cry, we have a good time. You know, there's just a lot involved with that.
Good to be around people who are facing the same issues that you are too.
Absolutely, and I really learned so much.
But she wants to teach everybody how to manage their diabetes, everybody in the state of Arkansas. We want to put up the information about the Bariatric Metabolic Institute because you mentioned that as kind of the last step option if you have to do that to get your weight under control. It's worked for so many people, hasn't it? And there's the information on your screen and also the website that you can go to. And if you're interested in the class, they can call the Heart Hospital.
They can call the Heart Hospital, 219-7000, and register for the class.
Good deal. Thank you so much.
Thank you so much,
Melinda. Being here.
Thank you for
Thanks
having
for your
me.
Work.